the FDA came out with a recent guidance talking about how they look at naming of drugs. But Donna, you've been involved in this process before. First of all, when you are asked to help with a potential name, what is the first thing you do? What is it that you start considering? What are the considerations going through your head?
So typically from my side of things, generally, and of course there are other pieces of it when you're talking about pharmaceuticals, but generally I look at, is a client going to get sued if they use this name?
Right.
Is the client going to be able to register this name federally and enforce it against other people, other users, other, third parties? Those are the big buckets. Is use okay and is registration okay? And those are two different considerations. Just generally in the United States, trademark rights are created upon use. So until you use something, you can't register it. But using it doesn't necessarily mean you can register it. So you really need to focus on both. The use is really real world. Am I going to get a nasty letter or a lawsuit if I use this? Registration is really in a vacuum. The trademark office doesn't look at what's happening in the real world when they're considering, are you entitled to a registration? They just look at their own register and whether anyone else has registered something conflicting and whether it comports with the trademark laws of the United States in terms of registration. So they're really two different worlds, and those are the first two considerations.